Cure.
I
It's
remember the Cure.
Friday. I'm in love. Dee-nee-nee-nee-nee-nee. How about
Um,
everybody's working for the weekend? Ba-na-na-na-na-na-na-na. Psh.
Everybody is, man. Everybody is. Look at you, man. As soon as the camera came on, you just came to life. You were like dead
Yeah,
before,
well, music.
But that's good,
Yeah, I
man.
was
That's
trying
good.
to.
Music
I
just
didn't.
gets you going.
I am tired. It's a long week, but it's a good week. It's a good week. It's big day Friday. Launching a second podcast today, Steve. I know you got a
Ah,
lot going
okay.
on too,
Yeah,
but
yeah, yeah.
it's content crazy Friday. So how about
Content.
you? You doing all right?
I'm doing
Heading
well.
into the
Thank you for
weekend?
asking. Thank you for asking, man. Yeah, I'm looking
Yeah.
forward to the weekend. I just saw the weather. The weather's going to be great in New York, so I'm looking forward to nice temperatures, getting outside, getting on the bike, and getting some
Right.
exercise. So it should be good. So
Wonderful.
I know we finished yesterday's show where we were sort of discussing um, about what it's going to be like when we go back to the office. There's a lot of webinars, information out there about return to the office, and I know we want to get back into that, but I just did notice that CDC had updated some guidelines. And I just want to sort of run through what some of those guidelines are, Mike, and we can sort of
Sure.
chat about chat about a couple because there's two or three in here I think that are really important and it's really interesting. I'd love to hear your feedback on it. And then there's also what I've noticed has been like a not an undertone. Undertone's wrong, but wrong phrase. But there's a consistent message going through this. So let me just sort of work this through
Okay, cool.
as we get things ready here. So the first thing that sort of came up was, is your building ready for occupancy, right? So this is guidance to building managers. This is guidance for organizations, and the big thing that goes through here is ventilation, and we'll hear about ventilation as we run through everything, Mike. So ensure the systems operate correctly. It's circulation of outdoor air. Outdoor air is a key thing the CDC have been focusing on these updates. And, even I just want to remind viewers that even if you don't want to sort of catch everything here, I've put the links in the description and you can link through and read this in detail that the CDC have provided. But outdoor air circulation, they mentioned MERV 13 and other filtering systems. But in essence, air is a huge thing the CDC are focusing on. And then there's their check there, a reminder that, you haven't been in the building. We haven't been in the buildings for a couple of months now. Make sure you run the water. So all that still water that's been sitting in the pipes through the
All right.
office, make sure
Yep.
you clear that. Moving on, it's identify where and how workers might be exposed. So making us focus on, what are the hazards that you may find? Identify the work and common areas. So, the kitchens, the conference rooms, what people might be touching. Make sure that you're communicating how employees should be acting in this. And then there's also a reminder is, organizations are really good at times of communicating to employees, but there are contractors who come into the office that really sometimes are overseen. So I think that's an important thing to see as or know as well.
Sure.
So
Yeah.
I just want to pull up another one. So that what they do also note is a hierarchy of controls. So the CDC have created this hierarchy, and it basically starts at PPE and goes all the way to where you've eliminated a contaminant. So it's just something, it's a great reference point. It's a great indicator of how we should be thinking about things. While we go on about PPE, actually PPE is the lowest form of control the CDC are recommending.
Hmm.
So one of the other things I want to talk about is
Interesting.
isolate workers from hazards, right? We mentioned that before. What does that actually mean? So it's modifying, adjusting seats for social distancing, right? We've heard about that. Use methods of physical separation for employees, signage, tapes, replace high touch communal items. I don't know if how do you replace a coffee machine or a water machine where
Right.
basically people have to touch stuff. Yes, there's some water machines where you go and it just automatically sensors, but in essence, it's like, how do you do it? And then they go on again about portable filtration. So again, how you clean in the air. Air is a huge concern for the CDC, and therefore, as workplace practitioners, we need to keep that a consideration too. And then they also say consider ultraviolet germicidal eradication. That's a bit of a tongue twister for me, Mike. But in essence, it's basically the UV lights, right, to eliminate
Yeah.
a lot of things. But the one that I think is really, really interesting, we goes to change the way people work, right? So if you have symptoms, encourage people to stay home. And I think it's where, at this moment in time, Mike, I actually believe we have an opportunity for human behavior to change. So we think about ourselves. I think organizations have often said, don't come into the office if you're not feeling well. And I think right
Sure.
now we need to take that responsibility on ourselves. And the CDC are saying they're encouraging people, if you're not feeling well, go home. But here's one that I find really interesting, and I really want to get your opinion on this. Employees should wear a cloth face mask in all areas of the business. So
Mm-hmm.
the
Mm-hmm.
CDC are saying this. So it really is an important point. I'm just going to skip through the slides here, Mike, so that basically we can show everybody the thing. But I really want to focus on what the two elements there, right? So face masks for employees. How do you feel about every employee wearing a face mask? And well, in essence, cloth over their face to cover their nose and their mouth. How do you feel about that?
How do I feel?
Yeah.
Uh, well, I don't know what you're looking for from me. I think that'll be the right thing to do, but
Uh-huh.
is it comfortable? Is it going to be a hindrance to productivity? Is it going to cause some dissension, some arguments, some, resistance? Absolutely, all of the above.
Mm-hmm.
And boy, that's a lot you just threw at me, or the CDC just threw at us,
Yeah.
and
Yep.
it's brings a lot of thoughts to mind. And thankfully, I don't need to rely on my own opinion. I have a network of people who really know their
Right.
stuff, and
Right.
it reminded me as you were going through some of those more detailed air filtration issues and some of the uh, different types of disinfecting opportunities and protocols. Next week, I'm going to actually get into some of this next week on my weekly Workplace Innovator interactive live stream. I've got a guest coming in from the West Coast, Wayne Witzel, who is from IFMA, from a large contract company that does disinfectants. He's been on top of this for the last 2 months, preparing buildings for reopening, the facility management side, the real
Mm-hmm.
practical side. I said
Mm-hmm.
it on a webinar he did early on. I remember being blown away by just the detail and the science behind a lot of it. So it'll be interesting to ask him some of these questions and how it works in the real world, how it's been working, how it will work going forward. Some of the other things you mentioned that just popped because I've been talking to some of my facility management friends and other workplace leaders, the coffee, the common high touch areas, the coffee, the idea that bringing in a barista may be a better solution for many organizations than having a coffee break room. And then the politics or the appearances of that. We've just furloughed 10% of the workforce or 20% of the workforce, but we're going to have a barista for the rest of us. And there's just some difficult, things going on there and challenges to face. But if you're following the guidance and trying to eliminate, I know that's what a lot of stores are doing that used to have, up in New Jersey and New York. Isn't Wawa a thing up in your way where you have all like the 10 or 12 coffee dispensaries?
Mm-hmm.
And the way they eliminated the danger of that is they hired people to start serving the coffee like a Starbucks would. So back to masks, though. Masks are a key. And, it seems to be the hot button issue in our society in general. And we're seeing flare-ups throughout the country. Those who are not buying into the guidance around masks. And I'll tell you what, I believe it's the right thing to do. If you're in public, if you can't social distance and you're in an indoor space, wear a mask to protect others. I've said this on this live stream. I've said it on my other show over and over again. It's not about me and protecting me. Masks won't do that. They know that cloth masks are not, like an N95, not going to filter out the virus. It's to protect you from spewing your potential asymptomatic droplets onto someone else or getting it into
Mm-hmm.
the air where someone else could pick it up. It's about the other. Think
Right.
of the other first. Yes, it's uncomfortable. Yes, it's annoying, but think about the other first. And I believe that, and I will practice that, and I have practiced that when I go out to the grocery store or to the post office, and those are pretty much the only places I've been so far in this quarantine life. But I've had my eyes opened. Again, we talked about it here. Let's get our eyes into the empathetic perspective or understand the other perspective, people outside of our bubble, people outside of our, world, and understand where they're coming from. And I talked to some relatives who are out of state, and one who's a nurse, and said, listen, the science is not quite as clear as you may think about masks. In fact, She reminded me about the CDC guidance 2 months ago when they said don't wear masks. In fact, they're ineffective and actually they're more dangerous in ways because the virus can get captured around the rim of a cloth mask, or if you're not wearing an N95 mask even properly, it's not fitted properly, the virus gets in. So there's just this confusion, right, Steve? There's this inconsistency in messaging, and it's a big concern of mine, and I've talked about it over and over again, from the top down, from the president to governmental leaders to local authorities to the CDC, the public health officials, and now to our organizations and our workplace leaders. Who do you believe? Who do you trust? Who's given us the right information? And for many of us, it's been tainted. It's been difficult to know what's right, what's true, and then it becomes this flashpoint of potential conflict if we have different people. And we talked about this a little yesterday, and it'll be continuing to be a topic, I'm sure, in the coming weeks, is that these conflicts you see in the general public and society are going to be translated into conflict and difficulty in our workplaces. So the mask issue is going to be one to watch for sure.
No, it is, and it's one of those ones. So I'm sort of thinking through, what does that mean for an employee, right, who is debating whether to return to the office? And if organizations follow the CDC guidance, they are basically going to be wearing a mask or a face cloth all day, which means when they get on and they interact, or when they interact with people in the office, that's fine. That'll be accepted because other people will be doing the same thing, and that's fine. What happens when those individuals get on a Zoom call or some other thing where they're actually wearing a mask and everyone else who's at home isn't wearing a mask? How will those individuals feel? And this is why, we wanted to follow on from where we were yesterday, because there are some things that we noted an article where somebody had identified the different behaviors that will need to take place. How as humans, we're just going to react. We don't know how we're going to react to these situations. We don't know how someone sitting at home watching somebody in the office with a face mask will react, or vice versa. We don't know how that individual in the office, if they hear someone sneeze or they see someone touching their face. I've just noticed myself, I've touched my face so many times, even just through this conversation with you. We do it all the time. And will we be judging people? And then obviously we joked yesterday about, the fact of people using Purell and how that's now everyone's going to be doing it. And but again, these are going to be behaviors.
Join the party, everybody.
But if you're not doing it, are people then going to be judging you on that? And it's going to be a real, it's going to be a community thing that we just don't know how people will feel about that.
Yeah, the cultural impacts are significant.
But
what's the point of all this, Steve? This is a good conversation, because why do we go to the office? It brings us back. We need to strip down all this protocol and say, what is the point of getting people back in the office? If we go through all this effort, and the guidelines didn't say this, but let's just say you follow these guidelines, or you put in place strategies, workplace strategies that allow for us to be adherent to these CDC guidelines. You talk to employees, say, all right, come in, wear your mask, don't interact with anybody, don't talk to anybody, don't risk, contaminating anybody, ride alone in the elevator, get up to your office, one-way directional traffic around the office. We've laid out the floor pan so you can't, bump into people. No break room, no coffee room. Don't use the coffee room to common areas, common touch surfaces. What about food? Well, how are we going to do food for this day in the office? Well, bring your own food to work. Okay. What about open spaces where we collaborate? Huddle rooms. No, can't use huddle rooms anymore. Can't be too close to each other in open collaborative spaces. Go into your office and close the door. All we did was create a home office in a building somewhere and add to it a layer of risk, getting there. And what's the point of that? That's not workplace. That's not collaborative workplaces, which is what we were talking about yesterday. Everybody wants the interaction with people. Right. So I don't know. You got to really examine this.
You paint a grim but important picture, and I'm laughing because as you're talking, I'm walking through, and what would that experience be like? And you're so right. And I think I don't know, man. I don't know. It's like why would somebody want to go into that? I mean, we know there are people that want to go back. There are businesses that feel they need to go back. And it's important then for those folks to continue. But I suspect that people are going to walk in and go, I feel more uncomfortable in this environment. I feel less productive. People may feel more productive because they got a place to go. They can sit down. They can put on their headphones. Their mask is on. They're in their own thing, and they just get through whatever it is they got to get through. Right? I can absolutely see that because maybe at home, roommates, small apartment, whatever reasons, right? There are attractions to
Okay.
that for some people, right? But to the community as a whole who would typically go into that office or want to go into that office, there's going to be no community. There's going to be no interaction. There's going to be no collaboration. And
Yeah.
then, yeah, what do those individuals do? I just have the vision of the Zoom, right? Everyone's using Zoom today, and people down in the town halls and they'll be in the office. How do you know they're in the office? Well, they're wearing the mask,
Yeah.
so.
Yeah. Now you know. Now you know they're in the. It's like, where's the benefit of that? We want to
Yeah.
attract people to offices. We want to attract and retain employees by giving them productive, safe spaces to work. So here's the good news, Steve. Again, call it good news, call it reality. I'm an optimistic guy. You are an optimistic guy. Let's try to paint that optimistic picture based on reality and what we're seeing in society today. It's only been a week or a couple of weeks, in some places a little more, where society's been reopened, right? And people are going out, and different people with different perspectives and different beliefs are acting accordingly to those beliefs. Many are being very cautious. Many are wearing masks in public. Many are social distancing. Many are staying away from enclosed spaces. And then you have the other extreme. You have the extreme folks who are just dismissing this and going out. And it's basically a big experiment right now because you see that there are groups gathering, violating the rules, the guidelines. So we'll see how that turns out. And again, I'm hopeful. I'm thinking, please, nothing's fundamentally changed about this virus. We stopped the spread through the lockdown, but the virus is still out there. So do we see a bunch of new spikes like you predict? Will we see this new, second wave of very serious cases in the fall and ICU beds being strained and medical staff being pushed to the limits again? I hope not. But is it possible? Yes. But I guess the good news about a free society and about a workplace setting too is that people are going to make their choices, and we're all about, as human beings, choice and control. And if we could, put aside the public health part of that, the collective part of that, which we went through, and we all did a pretty good job of that these last couple months. Well, now it's time. I guess we're going into this other phase of everybody making their own choices and everybody taking control of their lives. And I think that those people who are totally disregarding the rules are a very, very small minority. I think there's many who say, listen, I'm going to be sensible, but I'm not going to wear a mask in my car or wear a mask when I'm by myself, 100 yards from everybody else outside. That doesn't seem to make sense to me either. When you see people wearing a mask where there's no one else around, that doesn't follow the protocols either. So I don't know where I'm going with this other than to say it's a big, grand experiment, and I'm hoping for the best outcomes. And the data will come in. We are data-driven people. We want to see what happens. We'll watch what happens as offices open. Some offices are already open. We've already talked about this, and people are going in and they're not wearing masks, and they're getting back to some type of what was normal pre-pandemic,
Yeah.
and we'll see if that works. And maybe it will. I don't know.
Yeah.
It's a really interesting situation we're in, and I mean, what are your thoughts on that? I mean, can you try to look and say optimistic and say, all right, well, let's see what happens and make adjustments along the way, or I mean, that's all you can do, right? We can only control our own world.
Yeah, I think that's what
Yeah.
we have to do, right? And you have to trust that everyone's making the decisions that, they've calculated the risks, they've looked at it, and they've assessed. And what we don't know, yes, we see images of lots of people in beaches and pools and so on and so forth, right? And we'll see all that again this weekend. What we don't know is how many of those folks maybe have been tested and have the antibodies and things like that, right? We just don't know. And I did hear one suggestion being floated around. Do we give people who have the antibodies some sort of ban to show that they can move freely and they do have the ability and can be on the beach and can do whatever, right? And I don't know if that's a suggestion. I don't know if people would do that because it would be, I don't know, you just know that system
Two
would be
societies
tested.
thing
Yeah,
we talked about.
yeah, but again, it would allow those folks who do want to sort of mingle and sort of go back to some sort of normalcy or however we all perceive normalcy to be in the future, to allow them to do that, and then those folks that maybe haven't been don't get a band, or everything's a different color. Now, there's a whole lot of different aspects of politics, everything around that too. But again, what it does is takes a lot of stigma away for those who feel they can move freely through the population.
Yeah, I want to correct something. I don't think it's exactly the same. Yes, it's true the virus is still out there, but we've been awakened to this thing, right? Even the most skeptical among us, even the most anxious to get out and resume a normal life, they know that there's a risk out there that they maybe weren't aware of before. And as you said, and maybe one of the silver lining, I keep saying that phrase wrong, but the silver linings of this whole situation is that people will be more conscious of their health and not go to work and not go to public spaces when they're feeling sick, because that was a problem in our culture, wasn't it? In our workplaces, it was almost the culture that, hey, if you can get yourself out of bed, you need to be there because, taking a sick day is looked down upon or whatever. Now it's like, take a sick day is you're the hero. Thank you for protecting us, the rest of us. Wash your hands, things like that. Yeah,
I actually think most employers wanted employees to behave that way. I think they wanted, because obviously the ramifications, if you're sick and you come into the office, the chances of you, one, getting from your home to the office and not being subject to something else and getting yourself worse, making yourself feel worse, and then bringing that into the office actually is potentially a huge cost to the organization. Cost in the sense of your colleagues can get ill from that, where now we probably individually feel, okay, now I don't feel quite right. My temperature is elevated. And right. I do all those and I take those precautions before I leave my home. And then I feel empowered to do things to protect my colleagues and allow myself to recover in an environment that I'm perfectly comfortable and, I can look after myself a lot better. So I actually believe most organizations and most employers actually wanted their employees to behave that way. I think as employees, we likely didn't.
Believe it. Or get the message. It's a culture question, right?
Yeah,
How effective was leadership in communicating what the culture is here, and what is that sense of psychological safety in the pure sense, not physical safety, but psychological safety of I can make this choice and be safe about my job, not losing my job, my manager won't be on me, all those things, the human interaction of immediate managers, leadership. Look at the example of right before this pandemic really blew up and everything got shut down. I remember there was a story in the news, and it's easy to pick on Elon Musk because he's out there and he's out there in the public and he's a big public figure. But the week before they were required to close the Tesla factory, he said, there were people that were grumbling saying, we're nervous about this virus and we don't want to come into work. And he said, you don't have to come in. You're not required to come in. If you're nervous about coming to work because of the virus, don't come in, but I'll be here. Wink, wink. What does that mean? It's like, that's the message. Like the culture says, if you want to keep your job, or you want to be part of this team, you'll be here. And those types of dynamics happen in every organization, large and small, I am sure. Those subtle messages, those unspoken messages. So that's going to be a big part of this landscape, this new frontier heading back into some reopening of the offices, is everybody's going to have their communicated message, their perceived message, their guidelines that are put out there for cover all the legal bases. Here's our protocols, here's our guidelines, here's what we expect of you. And then I understand that mask is uncomfortable. We don't really need you to wear it, but it's our guideline. We don't need you to come in, but you can work from home if you want. I don't know. It just depends on the organization and the culture and the individual. It comes down to individuals making their choices. That's why it's going to be very, very interesting to watch how it all plays out in reality. And again, I'm hoping for the best in all of
Yeah,
this.
yeah, and I'm fascinated to see how things open up, when they open up, and where they open up. Interesting to see you can just imagine LinkedIn, Twitter, everything, Instagram blowing up with images of all these employees who are coming back, and images being spread around. This is what my office looks like. That's what my office looks
Oh
like.
yeah.
It's going to be interesting to see how all that gets portrayed too, because people will be making judgments on organizations from that aspect as well. This is how they're doing, how they communicating this. Can you believe my organization has done this? It's just like, there's a lot of
Yeah.
stuff. There's a lot of stuff to think through.
I just heard something yesterday, Steve. I was on one of my local IFMA chapter happy hours, and I just love to go to those and sit and listen to others talk, and
Mm.
because I'm done talking and I talk too much. But to hear other actual FM practitioners and describe what's going on in their workplaces and their buildings, many of them, I was surprised. I thought it was the West Coast big forward thinking, Silicon Valley companies that were all saying we're closed through the end of the year. The building's not even open. Don't even come back. You're working from home till 2021. A couple of folks on my call yesterday said the same thing about their local organization. Smaller companies, but still sizable companies. 500, 1,000 employees. This building's not opening until 2021, and
Yeah.
we're just we found effective working from home, and we're going to continue to work from home. So that may be more common than I thought. That may be more, as you said,
Yeah.
something that's going to be a typical. If you can work from home, and you've found this last 2 months to be a successful work from home experiment, why change?
Yeah, and I take all the information that I hear from those who contribute to Open Source Workplace, and obviously the groups I participate in. And I think it is a lot more widespread that organizations are not making decisions today about opening their office. There are small organizations who actually have made the decision that we're not going to go back to the office. We're going to try this work from home for an extended period of time to see how that works, because it gives the employee the ability to plan and the ability to make this life decisions about what it is they want to do and where they want to be. And I also feel then we are going to then reevaluating how real estate is used, not necessarily just workplace or the workspace, but actually the physical location we put our buildings, the physical location and the size of the offices that we choose to have. And again, I go back to those people who've been on the show. They are anticipating that the large cities, the offices will shrink in those large cities, but actually we'll get more suburban, smaller offices around that to allow those employees who do live in the vicinity, who can go into the city as and when needed, but actually then have the ability to interact with their colleagues in a smaller environment where they can drive to an office, where they can walk in at ground level and actually collaborate with other employees. And that's going to be a really interesting model. And the other one model I'm really interested to see that I think organizations can leverage is the use of co-working locations that are local to where people live, and having the
Yeah.
flexibility to select an appropriate space that works for the functions and tasks that they need to do. I mean, I think we mentioned it yesterday, the day before. I think we're going to get to the point where you wake up in the morning, you look at your calendar and go, what do I need to do today? Where's the best place for me to do those functions? Is
Right.
it at home? Is it in the office with all my colleagues? Is it, no, my home's busy today, I can't be here, I'm going to go to a local co-working office where I can get in an office by myself and sit down and work. And I think all this is going to be fascinating to see how it unfolds, and it's going to be such a slow, iterative process. We want everything to open up, but actually I think it's going to be a lot slower than what people are anticipating. I could be 100% wrong, but who knows? That's just in my opinion.
We'll see.
Yeah.
We'll see. Good place to end it. I like that. And we'll have a chance to reflect over the weekend, get some relaxation. You got anything planned this weekend? Just besides the beautiful weather, get outside?
Get out on my bike, man. Just get some exercise. Good. And yeah. Should be fun. What about you?
I expect to see you bright-eyed and bushy-tailed on Monday morning.
Likewise. Have a good weekend, man.
All right,
I'll
man.
speak to you soon.
Take care.
Cheers.